Hello, hello. Welcome to today's live training, wherever you are watching from. As always, I am really happy to be here. Today's topic really is the basis for kind of everything that I do here at Clinical Connections Mentoring, which is guide and support you to manage or avoid burnout in your career. But today I'm going to specifically talk about how to manage burnout as a new grad. I get a lot of questions from new grads who are experiencing burnout to the point where they're already questioning if they've even chosen if they've chosen the wrong career. Y'all, this is not okay. It makes me so sad to hear that new grads are questioning whether or not they made the right career choice within their first year of graduating. It's not okay. But I get it because there are some really shitty situations out there, and the current state of rehab is not that great right now. But that does not mean that it is true for every clinician and every job and every pathway that there is for rehab clinicians. Okay. So that's what I want to talk about today. I want to first give you some things to look out for as a new grad so that you can kind of steer clear of some of those bad situations that can result in burnout. And I want to give you some strategies you can implement now if you are currently experiencing burnout so that you can start to manage it now and turn that ship in the right direction. Okay. I love being a PT. I love what we know. I love what we can do for people. I love the impact we can have in our communities. And chances are you do too. It's really what brought you to this profession in the first place, right? Our patients need us and they need our skills. And we cannot have so many people wanting to leave this profession because we can do so much good for them, right? So my hope today is to give you a bit of information to help you manage this now. For anybody new here watching, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that there is for PTs. I've worked in a lot of different outpatients. I've done pediatrics. I've done travel physical therapy. I have worked in acute care, oncology, worked in a lot of skilled nursing facilities. I've been a rehab director at a skilled nursing facility. I'm an adjunct teacher. I do a lot of lab assisting in PT schools. And now I own a cash-based practice in Florida where I work mostly with gymnasts and cheerleaders, but I'm also the owner of Clinical Connections Mentoring, which is where you are today. So again, thank you for being here. As a new grad clinician, you may be feeling overwhelmed and stressed with your current job situation, or maybe lack thereof, right? The problem is, you may have been led to believe on your clinicals or from other clinicians that this is just how it is. Not as a clinician, you have to deal with it, or you got to push through it, or even that there's nothing you can do to prevent burnout as PT. Who's heard that, right? That probably has you feeling really frustrated and deflated and maybe even stuck. Maybe you've reached that point of enough is enough. Totally makes sense why you would feel this way. But what I know and believe is that you do not have to stay stuck in a crappy situation, or that you have to experience burnout, or that you have to figure out what's best for you on your own. I don't believe that, right? So today, I want to help you figure out how and where to make some changes so that you can love this career that you've chosen for yourself. Okay. So let's start by defining burnout. So, burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It is characterized by three dimensions: feelings of energy depletion or exhaustion, increased mental distance from your job or feelings of negativism or cynicism related to your job, and reduced professional efficacy. Okay, so that's the definition of burnout. So go ahead, if you're watching, I want you to drop me or give me a wave if you feel that now currently, whether you already have a job or you're like you've just graduated and maybe you're feeling the burnout from school in that transition to finding a job. Drop a me if that's you, or wave to me. That may be feeling exhausted or having low energy at work, like you have to drag yourself out of bed every morning and you're just feeling constantly tired every day, or having negative or cynical feelings when you think about your job or even your career, like you have nothing positive to say about your job. Or maybe when a volunteer or high schooler comes to your clinic, tell you they want to become a PT, and all you want to do is tell them to run for the hills. feeling like you aren't able to be effective at work or have an impact with your patients, like you aren't able to help your patients because you don't have enough time with them or your job doesn't let you be creative with your treatment sessions. Maybe you find yourself doing the same thing with every one of your patients on your caseload. If that's you, drop me, wave at me, give me some indication that you're kind of resonating with that. My guess is that you are feeling some of these things. And I know that because these feelings are becoming all too common. I get emails and messages all the time from new grads telling me these exact things. So I want to start with talking about some of the things you look out for when looking for a job. So I call these external factors that can lead to burnout. They're basically some red flags, okay? I call them external factors because they happen outside of you, and there's really very little that you can do to change them. So when you're looking for jobs, you want to look out for these things because if they are present, you cannot change them, and there's a very strong possibility that that will result in burnout for you, okay? So some external factors are things like management or negative work culture. So like having a boss that makes it difficult to communicate with, or having a boss that likes having control over everything. Okay. Another example is productivity requirements, right? Especially those unrealistic productivity expectations, like 95% productivity, or being expected to bill 4 units with every patient on your schedule, or being expected to treat 20 patients a day. It's a lot. Okay. Another external factor is reimbursement, which is most likely the greatest internal factor relating to burnout for rehab professionals. We know reimbursement's a problem. As it continues to decline, staff are then expected to work more and bill more to make up the difference. Okay, we know reimbursement is a problem. But when you put all these things together, it might look something like this. You accept a job offer that tells you you're expected to see 16 patients a day. Not terrible. However, after you start, your boss says that since reimbursement's getting worse, everyone is now expected to bill 4 units with every patient that you see, and you're expected to perform tens on every patient, no exceptions. You aren't sure about this, you want to talk to your boss, but her door's always closed, or she's always on the phone, or she's in a meeting. So you never get a chance to share your thoughts or concerns. Right? It's a pretty ugly picture to paint there, but these things are happening. Okay. The problem here is that we cannot change these things. There's very little we can do that is going to have an impact right now. So you must look out for these things when you're applying and interviewing for jobs. Okay. You can get a feel for the type of boss that you're going to have when during the interview, right? When they're interviewing you. Ask yourself these questions. Do they seem supportive, or do they kind of command control of the entire interview? Do they seem open to communication and new ideas, or no? Do they seem kind of closed off, my way is that or the highway, right? Do they let you speak during the interview, or are they more telling you how things are going to go if you work there, right? So ask yourself those types of questions during the interview to get a feel for your boss. Also ask about the productivity standards. What is expected of you? It's okay to ask that question. You need to know that before you decide to take that job or not. Okay. What's your expected schedule? What days of the week do you have to work? What are the hours? Can any of that be changed, or is that set in stone? And do you like how that sounds, or do you want more flexibility? If the job is a Monday through Friday, 12 to 8, do you want to do that? Or is it just the only job offer you have right now? Right? So you got to ask what the specific schedule is. What are the hours? What are the days of the week? What is expected of me? And are you okay with that? Talk to the staff. Do they seem happy to be there, or are they kind of stressed and overwhelmed? They seem stressed and overwhelmed, chances are you're going to feel that same way at that job, right? So talk to them, get a feel for how the staff is. If any of these answers concern you even a little bit, this probably is not the job for you, okay? Now, most people are going to tell you that these things, bad management, terrible reimbursement, unrealistic productivity standards, they're going to tell you that these are the things that cause burnout. But I'm telling you that there's much, much more to burnout than just those things. Yes, these contribute to burnout and they are part of the problem. I'm not denying that, but these are not the only causes. The other causes are what I call internal factors. These are factors within you. They are things that you can start to recognize now and things that you can have control over. These are things like perfectionism, wanting everything to be perfect. I see this a lot in new grads. That feeling that you need to be the perfect clinician, the thought that you have to know everything in order to be able to help your patients. This looks like working more hours to get more experience so that you can be the perfect clinician. Problem with perfectionism is that it does not exist. I say this all the time. Perfectionism does not exist. Perfection does not exist. Okay. If you are striving to be the perfect clinician, you will never stop. You will always be chasing something that does not exist. Trust me. Even the best clinicians, the ones that you look up to right now, they are not perfect. They have patients come to them and they get stumped too, right? Now, it is okay to want to be better, and I am all for you wanting to be better, but striving for perfection in your first year as a clinician is going to lead to burnout, okay? The answer to being a better clinician is not working more, working more than 50 hours a week to learn and experience more things. Because now what you're doing is spending all of your free time at work, not enjoying your time with your family and your friends. This will lead to exhaustion, right? Instead, just strive to be 1% better than the day before, right? That can be simple, small things, but you're still 1% better. You're getting better, okay? Simple things like trying to be quicker with your documentation or getting better at asking questions during your patient history or just improving your hands-on skills on one specific skill at a time. You're trying to get better at all of the things at one time and you think the way to do that is to work more, you're going to burn out. You've got your entire career to become a great clinician. You do not have to be a superstar in your first 3 months of work. Okay. The next internal factor is imposter syndrome, right? That feeling of self doubt along with the belief that you are not deserving. Imposter syndrome is those two things. It's not just self doubt. Imposter syndrome is self doubt along with the belief that you are not deserving. Listen, everybody experiences self doubt, and it always shows itself when you are starting something new. Okay. It's okay to feel doubt, right? It kind of tells you, I want to be better, right? That's okay. Everybody has self doubt, right? So it's no surprise that as a new grad, you're feeling imposter syndrome. Remember, imposter syndrome is the feeling of doubt coupled with the belief that you do not deserve to be where you are. I'm going to tell you right now, you absolutely deserve to be where you are. You earned your degree, you studied your ass off, and you passed your boards, and you shined on your interview, and you were offered that job. You are right where you are meant to be. Okay? Imposter syndrome manifests itself in false beliefs. So it looks like signing up for CEU courses every other weekend while you're also studying for a specialty certification so that you can learn more techniques because you don't feel like you've done enough work to be able to effectively help your patients. Give me a wave if you thought that, okay? This is not the answer. Learning a million new techniques is only going to add to more confusion when you're trying to decide the best thing for your patients, right? Getting more letters after your name means absolutely nothing to your patients. They don't care the letters after your name, right? So spending all your time trying to learn more, spending your free weekends in another classroom when you just graduated is going to result in burnout, okay? Your first year as a clinician should not be spent learning more skills and techniques. And I'm not saying not to take CEU courses. Don't hear what I'm not saying, right? By all means, you can learn new things, but just give yourself some time at first, right? There's no rush to take all the CEU courses and get all the certifications in your first year. Instead, just focus on applying what you've already learned. You've just spent 3 to 4 years learning a lot of stuff. Just focus on applying what you've already learned. Focus on just getting used to working with your patients on a daily basis. Get into your own routine, figure out how you want to treat your patients. Just focus on that for right now. This will serve you and your patients far better than learning more tools, than adding more tools for your toolbox. Okay. The last internal factor that I want to talk about is people pleasing, the desire to help others, even at the expense of your own needs. Okay. This one is really, really, really easy to fall into, especially for new grads who want to make a good impression. Okay. As PTs, helping people, it's in our bones, right? It's what led us to this profession in the first place. We want to help people, but people pleasing can be a very slippery slope towards burnout. Okay. This looks like saying yes to your boss when they ask you to help out at the health fair on Friday evening after work hours. You've already worked 40 hours. Oh, we have this health fair I need you to be at. Can you do it? You say yes to your boss because you want them to think you're a team player and you don't want them to be mad at you, right? This might seem really innocent at first, but soon you're asked to do another out of work activity and you say yes again because you want to make your boss happy. This might seem, right? Seems really simple, but what happens is before long, your boss starts to realize that this one, she's always going to say yes. So I'm going to keep asking this one. And before you know it, you're now frequently working overtime and you're not getting paid for it. Then you start to resent your boss. You get angry because you're the one that's always doing the extra task, and suddenly you're burned out. So instead of saying yes to everything that you're asked, take a moment and think about it. Ask yourself, do I really want to do this specific task? If the answer is yes, I really, really want to volunteer at the health fair because that's something I enjoy doing, then do it. But if the answer is no, I'm just doing this because because I want my boss to think that I'm a team player. If that's what you're thinking, then the answer is no. Do not do that thing. Okay? So to recap, there are external and there are internal factors that lead to burnout for new grads. External factors to burnout can be managed by looking for these specific red flags when you're applying for and interviewing for your job. If you don't like something about the job, chances are that thing that you don't like is just going to grow into a bigger problem for you. The frustration and the irritation will just build and build. Result is burnout. Internal factors to burnout are things within you that you can change. You do have control over them, especially for a new grad. Things like striving to be perfect, feeling self-doubt and like you don't deserve to be there, and making decisions just to please other people is going to lead to burnout. Burnout happens when your own values do not align with the values of the company or the people that you work for. This includes those unrealistic productivity standards, working overtime without being paid for it, whether you choose to or not to, believing that you need to do more, even to the point of exhaustion, in order to prove to somebody else that you are capable. Okay? It also comes from doing things over and over and over again that you do not want to do. So I may have mentioned something today that you're like, well, I kind of like doing that thing. That's fine. That is totally fine. If you truly want to do something and you want to do it for the right reasons, you're going to be fine. You're not going to burn out. But if you choose something or you say yes to something for the wrong reasons or because you think you should do it, that's when you're going to end up in burnout. Okay. I get it. I know this can be very hard. You've heard some pretty scary stories and you don't want that to be you. I get it. You want to be a great clinician, but you also want to enjoy life, right? And you don't want to regret your choices. It is okay to want those things. As a new grad, I hope that right now you are really excited to start this chapter of your career. I know that you're excited for the new challenges ahead, and you may also feel a little bit nervous or scared about this next step because you've heard a lot of shitty situations. But I want you to know that those situations do not have to be your stories. Okay? You can absolutely love this career that you've chosen. I don't want you to have to second guess this choice. I want you to be proud of your choice and I want you to love your job. And there are so many paths that you can take in the rehab world. So if you'd like a little extra help in getting started with building a career without burnout or picking the best first job for you, or maybe it's been a year, you've been in a clinic for a year and you know that something needs to change, but you're not quite sure what that is, send me a DM. drop ready in the comments right now. Let's start a conversation about what you can do. Let me help you figure that out. For those of you that want to dive a little bit deeper into learning how to choose the best job for you or manage your internal factors, or how to make time for you in a way that's specific to you, I invite you to fill out an application to my Complete Clinician program. I'd love to tell you more about it and what it can look like for you. And so, there's some information about that program. It covers so much more than burnout. It's a 6-month program, and I will help you improve your confidence as a clinician, build your communication so that you can advocate for what's best for you and your patients, strengthen your clinical reasoning skills, learn the skills to be a strong and motivating leader, discover the steps and systems needed to start your own business if that's what you want to do. And there's even stuff about learning how to transition into academics if that's where your career takes you. In any capacity, I'd love to help you gain the power, the courage, and the confidence to build a career that is free from burnout and that allows you the freedom to love your job and also enjoy your free time. It's possible. I hope you learned something new today. Please go ahead and drop in the comments your aha moment or something that really stood out for you or something new that you learned. I want to thank you again for watching. If you have any questions about anything that I talked about today, please feel free to message me or leave your questions in the comments. I will come back and answer them. Have a great day. See you next time.